My name is Andrea Covey. I came to the Kansas City VA to found our lung cancer screening program in 2018, and we now screen about 4,000 patients annually.
I'm a retired veteran myself. I served in the Navy for 9.5 years, and I served in the Army for 10.5 years. And my goal is to make sure veterans know about the lung cancer screening program and the care that they can receive. The scan actually takes 3 to 5 minutes. You spend much more time just in the waiting room and checking in.
When we find those few patients that do have lung cancer, our goal is always to have a clinic that's staffed with pulmonary, oncology, radiation oncology, and cardiothoracic surgery. And we want all of those to be collaborating on the patient with every visit to discuss what the findings are and what the next steps are. And so our patients, we almost always have them from abnormal imaging to a biopsy within a month.
The multidisciplinary thoracic clinic is kind of like a one-stop shop for patients. Wanting to expedite the process is essential for the outcomes and the quality of life that you'll have. Every day that we're waiting is that cancer continuing to grow. So the faster we can get you diagnosed, the faster we can get you treated, the faster you get back to living your life.
We want to be ready to offer lung cancer screening to any veteran that benefits. And as part of our work in that, we also set up a remote location in Poplar Bluff. I wanted to eliminate rural disparities.
People in the rural areas can go and get a screening done there. Then they can talk to one of our doctors here at the Kansas City VA using what's called a telehealth clinic. And then if they have to come and get a procedure done here at the Kansas City VA, we offer the Fisher House. It's free lodging and free food for them to come here and get the procedure done.
The national statistic is that about 5% of eligible patients will be offered lung cancer screening that need it. And here in our system, we're offering over 86%.
There's really no program that is comparable to the comprehensive level of care that we are able to provide. The veteran population is very near and dear to my heart. My grandfather is a veteran, my father is a veteran, my uncles are veterans. They get their care in this building. From going from being an ICU nurse caring for the sickest lung cancer patients to calling patients and saying, hey, you possibly have something, and 3 weeks later, you've been diagnosed and treated and you're back to living your old life with the very minimum side effects, if any, is just, I can't put it into words how fascinating and how fulfilling it is. I'm really hoping that what we have built becomes a template for other VAs to be able to use to expedite the care for our veterans across the nation.
We want to be not only the health care that veterans get, but we want to be the health care that veterans choose.